Hey CHWs, welcome back to Public Health 101. Today we're going to be talking a little bit about our social determinants of health. We've talked a little bit about determinants and how those are things that have an effect on a particular item. Today we're talking about the determinants of health, and particularly the societal or social determinants. We, of course, want you to focus on and understand the social determinants of health, be able to identify where social determinants fit, and maybe discuss it from a narrative standpoint for yourself. When we think about ways to improve health across society, there are so many things we might want to do. How do we decide where to invest our time and resources? Well, let's take a second to consider some of our options for interventions. We're going to borrow from Dr. Kamra Phyllis Jones's example of the good health and the cliff of good health, and kind of illustrate some of those options. If someone were to fall off of a cliff, obviously we don't ever want that to happen, but how would we respond, especially if we started seeing that becoming a more common occurrence? Well, one of the things that we could do is we would say, hey, we're going to just keep an ambulance at the bottom to quickly be able to pick them up and get them the care that they need. But is that the best response, or are there other interventions that could be taken? A safety net could catch people after they fall. The person still falls, but the net softens the fall and prevents them from experiencing the harm that might have been done if they were to fall with no net there. But is that the best option, or are there still more interventions that might occur prior to the need for a safety net? A fence could be installed to prevent folks from falling in the first place. Now, they're not going to fall at all, or maybe they might. Maybe there are still other steps that could be taken even past the fence. We could say, hey, nobody is getting close to the cliff, and take measures to move the population further away from the cliff face to, again, prevent a fall off the cliff at all. Each of these represents a different level of intervention, and another example that will kind of align with these is infant mortality as a real-world example. The ambulance in this case is what we see as medical care. In infant mortality, this would be the intensive care unit. Usually those ICUs are found inside the hospitals near where the delivery room might be. The NAT represents some level of secondary intervention or prevention. For infant mortality, this would be monitoring people during prenatal care or before delivery. The fence at the top represents primary prevention. Think of programs like WIC or SNAP or any other efforts to make sure pregnant women have adequate nutrition. And moving the center of the population away from the cliff face represents addressing the social determinants of health. Addressing issues like jobs, living conditions, education, discrimination, just to name a few. These are all things that shape how at risk for falling off the cliff or maybe infant mortality various groups and individuals may be. Addressing the social determinants of health has moved the center of the population further from the side of the cliff, but it has not addressed why there are differences in who tends to be closer to the cliff side or at risk of falling off of the cliff in the first place. Doing that requires social determinants of health disparities. And this requires thinking about the systems that make resources unevenly distributed and intervening so that we're not just moving the center of the population further from the cliff, but also shifting things so that those most vulnerable are being moved further from the risk of falling at all. So let's try to understand these social determinants of health even more. We have a definition here: the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Now, what makes up those social determinants of health? We've got 5 factors here. One of those being education, access, and quality. Some of the examples of that might be high school graduation, your language and literacy levels, enrollment in higher education. Another social determinant of health is healthcare access and quality. Think of, what is my health literacy? Can I read forms and fill them out in the right way? Do I have access to a primary care provider? Neighborhood and your built environment are another social determinant of health. Think, what is the crime and violence level? What are the environmental conditions around my neighborhoods? Do I have access to clean drinking water? The context of your social and community levels are also a social determinant of health. I think civic participation, meaning how many people actually are going out and voting. Do they know who represents them? Is there a large level of discrimination where they live? Is incarceration at high levels where they live? And finally, economic stability. Think, does a person have employment? Do they have food security? Are they living in poverty currently? And how does that determine their health? I'm sure you could think of a few examples. But all in all, we want you to think, what are these social determinants and their relationship to health overall? Obviously, we could see that maybe one or these might have a heavier load in determining health personally, but think about your neighbors or think about somebody in a different state, and then even take it to a different country. We all have different levels depending on where we are or how we came up, and all of those end up having an effect on our overall health. And for this forum or discussion question, we want you to pick one social determinant of health. All 5 are listed here at the bottom of this slide. But we want you to think and talk about what the relationship between this social determinant of health is and how it affects and what the relationship is with the individuals, maybe of someone that you know or just generally, and how does it affect communities.